just get that going. So I thought, first of all, if I could get everyone to, I'll just go around the screen and get everyone to introduce themselves. So I thought I might start with Marg, if that's okay. Marg, can you give me, and I'll, for the purposes of this webinar, I will be the host and facilitator. So whereas last week we had a lot of participants asking a lot of questions. If I can think of other questions that I've heard before, I'll ask you those questions as well.
Great.
So Marg, tell me a bit about all the hats you wear, because you've got very many. Tell me about Dr Margaret.
Right. Well, it's pretty boring, but I've been here for 37 years. I saw in the supervisor newsletter that Mark Zagorski's just hit 40 years in Mount Beauty, which is pretty amazing. So I've got another 3 years before I get there. I came here because I fell in love with my husband, and he was from here, so I had kind of no choice, and it was the best move I ever made. I thought I was going to be a GP on the Surf Coast and live in Torquay, but yeah, who'd want to do that? So I, in the last 37 years, I've worked as, obviously my first and most important job is to work for the community of Portland as a GP, and that's been by far the most fulfilling job. And I was just saying on the Zoom I just left that my patient cohort now is much older, but I find them fascinating and so rewarding, and they've got such amazing stories, and they're all just beautiful people. But I've also run family planning clinics. I've been the medical officer of health, so, you know, the forensic doctor as well. I worked in occupational medicine for the smelter. We run Doctors in Schools program. We do a lot of we work for the smelter in terms of doing pre-employment medicals. I've worked obviously before, in the first 25 years, I worked in the emergency department, admitted patients to hospital, did the whole 360-degree care thing. And then later on, I got involved in education, and that's obvious. When I first moved to Portland, I felt incredibly professionally isolated, and that's the reason that I got involved in education, because I think if you're going to work in the country, you need to feel secure, safe and supported. And so that's why I got involved in this role. And I can tell you that, you know, 37 years down the track, registrars are safe and supported a lot more than they ever were when I just kind of turned up. So that's been also a really gratifying part of what I do. And I also run the Cape Nelson Lighthouse, and we've got, just an ad for Cape Nelson, we've got 5 little cottages. We sleep 18 people, and it's a really amazing place to stay if you're interested.
I'm going to make a note of that.
www.capenelsonlighthouse.com.au.
Is there MCCC discounts on accommodation?
That's mates rates, isn't that what it's called? Yeah, well, and we've got a lot of mates. We run a little cafe, and we take tours up the lighthouse, obviously, and to the local gannet colony. But you know, the accommodation's what I'm really passionate about. So that's me. Now move on.
That's wonderful, and really thanks so much for sharing that, because it shows that you're not. You are many things, including a doctor in your community.
I think you just inevitably become so in a rural community. Yota would probably agree with me that you know, you're not just a doctor. You just, you know, you become part of the fabric of the community, and I think that's one of the great things about working in a relatively small place rather than a suburb.
So I might move on to Yota. Would you like to give us a snapshot of you as a registrar I know later on we'll be going into your pathway and some of the things that you've learnt, but just tell us about who you are and where you are right now.
Sure. Thanks for the kind introduction. So my name's Yota Yoshimitsu. I am a registrar in, well, my image is a bit out of focus, there we are. I'm a registrar in Hamilton and Haywood. So I work at Hamilton Medical Group, which is a fairly large rural GP practice, and also work at the Windamara Aboriginal Corporation in Haywood, which is an Aboriginal medical service. So I split my time between those two practices. And I've also had the privilege of being able to be involved in MCCC educational activities too, as a registrar and medical educator with MCCC as well. So Marg is my boss, and she's been excellent. Look, I'll talk a little bit more about my journey in my sort of presentation, but I mean, briefly, I did medicine when I was as a mature age student. I started off life as an optometrist, actually, so I did that for
Did
a
you say
while.
optometrist? Sorry, I
Yes.
it just slightly cut out there. Yeah.
That's right. So I did that for a while before I sort of switched to medicine, and I suppose my connection to the Southwest is probably from sort of studying in Deakin Medical School in Geelong, and then I spent quite a few years working with Bowen Health at Geelong Hospital, and I think I've kind of slowly inched myself sort of more Southwest Victoria. So so going from Geelong to Colac to Warrnambool, Hamilton. So I'm kind of sort of, and I'm here at the moment. So that's kind of my sort of geographical sort of journey. But look, it's in terms of where I'm at the moment, I'm hoping to finish my exams this year and fellow. I've been here since about start of 2019. So it's been a real pleasure to be here, and hopefully I've grown, not just in girth, but but in terms of my experiences. Well, I think I've actually lost a bit of weight, people tell me, but anyway, jokes aside, I think the last couple of years being here has been a really really good experience in a lot of ways, and I'll share with you a bit more when I do my presentation.
Very much looking forward to delving into that, Yota, and thanks for making your time. I'm going to go to Leanne next. Leanne, can you tell us a bit about you and your role and your connection with the Southwest as well?
Well, that's a very hard act to follow after Marg and Yota, and I'm looking forward to hearing about Yota's journey. But I'm Leanne Dix, and I'm the Barwon Southwest VRGP coordinator. So I'll speak a bit more about the program and the opportunities in the region. But basically, I'm the person that coordinates and supports with case management and connecting trainees with stakeholders, health services, and opportunities around the region. So yeah, not very. Just I'll probably point to a few more other things later down the track. And I'm situated in Port Fairy.
That's what I was going to say. You live in the Southwest, yes.
Yeah, live in Port Fairy, and where I'm situated a couple of days at Southwest Healthcare, but basically go to Barwon, Hamilton, Portland. When COVID lifts, it'll be beautiful to be face to face rather than over this virtual platform. But anyway, we'll have to just wait and see, hopefully next year.
And then we can shower all the participants of our live presentations with pizza at that stage.
Yeah, that's right.
Catherine, I was just wondering if you'd like to tell us about your really fundamental role in the registrar journey, and a little bit about your connection with Southwest and the wonderful role you play with MCCC.
So my name's Catherine, and I'm the REAPS coordinator for the Southwest region. So REAPS stands for Registrar Education and Practice Support Coordinator. So essentially my role is overseeing all of our stakeholders. So yourselves as registrars, I work really closely with you. Also our accredited training practices and our supervisors as well. So essentially I oversee all of your training requirements, making sure that everyone is meeting their college obligations and doesn't get stuck, you know, down the track with missing something. That's a big part of my role. So largely, as a bit of a background, I've been with MCCC and SGPT prior to that, coming up 10 years in November. Previously, I was a training support officer. So I was in the background a little bit and moved into my new role a couple of years ago. So I work closely with Marg, making sure that we're covering everyone. And also, you know, that's a big part of what I do, is making sure that everyone's meeting what they need to. For our new registrars coming in specifically, you know, you have that one-on-one connection with myself and our operations team.
And that's something that we'll explore later, is how much support. And when you look at the people on this call, pretty much everyone is involved in some element of support for registrars at whatever part of your journey you are in, if you are accepted as an AGPT candidate. So it's really great. My name is Anna Stephenson. I'm Manager of Rural Program. And as such, I seek to strengthen and grow the relationships and the connections to support all registrars undertaking rural and rural generalist training with MCCC throughout Victoria. In the 3 regions that we support and the 4 VRGP regions, which Leanne will go into later. And as such, it basically is about making sure that we're joining up the support and the opportunities with you through the multiple connections that we have in all our communities. So delighted to have you here tonight. I also just want to encourage that and let you know that tonight we'll be taking an intimate approach to AGP Intake 2. And therefore, I'll be asking some questions of each of our presenters tonight to give you an idea of some of those nuts and bolts fundamentals and the key things that might help you make your decision about applying for AGPT, the Intake 2, which will close very shortly, and we'll go into that soon. So without further ado, or ado, not ado, I will just share our screen. And just start the slideshow. So for all of you, it will be obvious at this stage because you've signed up for this webinar because you're considering. I know from looking at each of your backgrounds that you are interns or JMOs in hospitals in Geelong. We've even got someone from Wangaratta who's interested in this, and also Warrnambool and Melbourne as well. So for you will be looking at applying to the RACGP intake for AGPT Intake 2. And MCCC training is situated in Western Victoria, which is a bit of a misnomer, because as you see, Western Victoria covers most of Victoria in terms of the regional map of this. So the particular region that we're looking at tonight is has Warrnambool and Geelong, so Barwon Health and Southwest Health. It has Portland Health, Camelot. So it has a range of large tertiary hospitals and also small to medium hospitals that are within this region, as well as a multitude of practices and practice opportunities. So I'm going to just quickly run through this, because this is where I'm going to call upon firstly Yota and then Marg. What can GP offer? And so it's my aim tonight is not to subject everyone to a paint by numbers PowerPoint presentation, but to use our PowerPoint presentations as a frame for the personal stories, and also answering some of the questions that you might have about making your decision to become a GP or rural generalist in the southwest region of Victoria. So as you can see, what can GP offer? It's subspecialising. One of the key things that I hear continually from the conversations that I've had with registrars is their real value around the continuity of care, that they really get to know their patients. And it's also not only getting to know their patients, but being able to work with staff within a practice or within a small to medium hospital, building the relationships that make you feel part of something bigger, and being able to embed yourself in the community. The other thing that I know many registrars and fellows have talked about is the tremendous flexibility that taking on GP training and becoming a GP or an RG can give you, in terms of not only your patient lists, but the types of work you want to do and when you want to do it. So before we go to Marg and or Yota and Marg, as you will know, I'll just go back. As you will know, we are now AGPT applications are open for RACGP positions. We have about 30 positions available across Victoria at this moment within the AGPT Intake 2. We encourage applications from junior or hospital medical officers or at any time in someone's medical career. These intakes, this is the second intake for the year. And at this stage, because ACRM applications have closed, we're recruiting for RACGP, rural generalist, and also rural pathway applicants. So these close on the 21st of September. So you haven't got long to put your applications in, but there are great opportunities which we're going to go into shortly. The training offers will be if you're successful in getting an interview, the interviews will be undertaken in the last week of November, from the 20th to the 28th of November, and the offers will be finalised before the 10th of December. So I'd just like you to take a look at these without me having to read it out, because I'm going very shortly to Yota once I've given you this opportunity. But as you can see, the flexibility and versatility of the training model is comprehensive. And as you will already know, there are options for advanced skills in rural generalism. In practice, teaching is done by qualified supervisors, and MCCC has a very, very strong commitment to high quality supervision. We've learnt in other webinars that, sort of GP training and GP supervision really is that high quality commitment. We make sure we deliver training to our supervisors, and I know Marg will probably talk about that a little bit later on. And with COVID, that there are very high quality opportunities for online and face-to-face COVID safe education, as well as talking about part-time training and leave options. So I'm just going to hand over to Yota to talk a little bit about his training experience and his pathway. And also at the end of this, we might be able to ask some questions about that as well.
Sure, thank you very much. Once again, I really appreciate the opportunity to talk to you all today. Can I just double check that you can see my slides okay?
Yeah, I'm seeing your presenter view at the moment.
Okay, let me just hang on a sec.
I think you might, if you look at the second screen or your different screen, you might have one screen that's presenter and one that's, yep, that will probably.
Can you see that okay then?
Yep, and it's not on your slideshow yet, but we can see each slide.
Sorry, let me just.
See, this is the beauty of this. We can get Alex to cut this out. It's all a-okay. Ah, beautiful.
Can you see that as a full
Yep,
full slide?
it's perfect now.
Okay.
Yep.
Great. Okay, so thank you very much. Really appreciate your time today. Look, I don't want to prattle on about you know, boring stuff. I just wanted to share my sort of personal journey about how I've gotten here to my what's led to me doing my GP training here in South Victoria with MCCC. So thank you for having me. Just wanted to start off with a bit of an anecdote. This is just to put it in context. There's lots of GPs across the world who are quite burnt out and frazzled, especially with the current climate that we're sort of you know, practicing with COVID and all sorts of things. And I came across this little letter to the editor. This is actually a letter to the Times of England, and this surgeon called Merrin Thomas was commenting on a sort of some you know, people who've been talking about stress and burnout and whatnot, especially amongst GPs. And he, in his infinite wisdom, wrote into the Times and said words to the extent that GPs work at the opposite end of the medical complexity spectrum. And he was basically saying that we probably need fewer GPs and more specialist nurses and pharmacists and counsellors, psychologists, physiotherapists, etc., working in primary care. Now, I have the utmost of respect to our nursing and pharmacy and counsellor colleagues, and I have no problems with working with them. But needless to say, this raised a few eyebrows, and people sort of wrote in. And I wanted to share this particular response from a chap called Sir David Haslam, who's, amongst other things, he's a GP, and he's also former head of chair of the National Institute for Health and Care and Excellence, or NICE, which is a pivotal organisation in the UK that actually tries to improve the quality of medical practice. He shared an anecdote about having to you know, attend a medical emergency in a flight that he was on, and he goes up to the back of the plane and he sees these two sharply dressed people in suits, and they ask him, "What sort of doctor are you?" And he says, "I'm a GP," and they say, "Thank God, we're only cardiologists," and they go back to their seats. The point he wanted to make here was not that he was a hero, but that GPs deal with most of the problems of most of the population most of the time. And I thought that was actually a really good snapshot of what we do as GPs. And I don't want to sort of it sounds daunting, but because it is in a lot of ways, because it's a tremendous responsibility, but it's also an immense privilege to be able to practice medicine to the extent that we can hopefully deal with most of the problems of most of the people in our community most of the time. And I just want to spend a few minutes just talking to you about hopefully why I think it's a really good journey to be on. This is me, believe it or not. This is my first passport photo taken when I was about, I think it was about 1.5 or 2. So I was born in Japan in a place called Osaka, not where the recent Tokyo Olympics were held, but a little bit further down south. And I suppose my journey started when I arrived in Australia way back in 1978 in October. So I'm a bit old. The presentation before said that the oldest GP registrar was in his or her 60s. So, we encourage people of all ages to train as a GP. So, but I came here when I was about 2.5, and I've lived in Melbourne for the last 40 years or so. And I suppose for the first 3 decades of my life, Melbourne was all I knew. I grew up in Melbourne, went to school in Melbourne, trained in my first degree as an optometrist at the University of Melbourne, and pretty much all I knew. And after I graduated, I took up a position at a place called the Australian College of Optometry in Carlton. So I spent a lot of my time when I was not working, enjoying the delightful foods of Lygon Street, Carlton. But in a way, that was a real my pathway to sort of opening myself up to discovering rural and regional Victoria, because my work as an optometrist actually took me to lots of different rural places in Victoria. So I did work in places like Ballarat, Bendigo, Geelong. I went to places in Gippsland. Also worked up in Mildura. That was a lot of fun. And I did that for quite a few years. I suppose those sort of early years that I I'd never worked in country Victoria, and I never actually saw myself ever, living or even working in rural Victoria. So those first few years, I suppose, really opened my mind up to discovering the beauty and the enjoyment of actually working in country Victoria. And I suppose my outlook sort of changed over time. I discovered that it wasn't just eyes that I was looking at, but the eyes are connected to the rest of the body, and these are not just a pair of eyes, but actual people that I look after. And I suppose I sort of developed a real sort of interest in actually pursuing medicine, and I ended up a few years later in Deakin in Geelong. So fast forward a few years, and I did my medical degree in Deakin at this lovely campus here in Warren Ponds, and found myself working at Bowen Health Geelong Hospital. And so I suppose one of the questions I was asked to talk about was why the Southwest. I suppose I knew Geelong well from my years as an optometrist, and it was actually a pretty comfortable move, actually moving to Geelong to study and eventually work there. And I was fortunate enough to be able to work at Bowen Health in Geelong, but my sort of rotations took me to all sorts of different places. At Warrnambool Base Hospital, I worked in Colac. I even worked here where I'm at the moment, which is Hamilton at Western District Health Service. And after I did my internship, I was pursuing physician training. So I actually worked as a medical registrar for a couple of years. And so that was kind of my sort of initial pathway into physician training. But then a few things happened. I suppose I didn't pass, unfortunately, my BPT written exam, so that's always gives you a moment to sit back and think, what should my journey look like here on, and do I attempt it again, or do I think about other options? And I remember at that time I had worked with some really good colleagues, and some of you might know Elise Davey, who's a GP in Leopold, just outside of Geelong. And Elise was actually one of my senior colleagues, senior med-reggers at the time. You know, I discovered later on that she'd actually made the transition from physician training to GP training, and I got chatting with people like her and about it. The more I thought, well, maybe general practice is really where my sort of passions lie. I mean, I suppose when I first started out as an optometrist, it was really very much working in the community as opposed to working in the hospital, and that sat very comfortably with me. I still enjoy a lot of hospital medicine, but I suppose a part of the community, working in the community. And I suppose eventually I saw the light and I signed up to GP training, and MCCC Southwest was a very logical and good fit for me because I knew the area. I knew a lot of people. I'd worked in a lot of health services in the region, and I knew they were a known quantity to me. And it was a very logical fit. These are just little signs that they put up at the airport, so I thought I had a bit of fun posing in front of these. But I think these signs, quite apart from the catchy slogans, I think no one knows you like your GP, and I think that's very true. And that's a very privileged position to be in if you think about it. Because for most of you who work in hospital medicine at the moment, I mean, your experiences are, you're seeing people for a relatively fleeting moment in time, aren't you? I mean, you're seeing them in emergency, or they're admitted to your wards as an inpatient. You might look after them for a period of time, but then they go home. And I was always sort of wondering, what happened to Mrs. Jones after she recovered from her actinic cholangitis? I mean, I wonder how she's doing. How does she go after we looked after, you know, was she actually still alive? How's she doing? And, you know, you sort of, some people, you know, I suppose felt comfortable about not having that continuity of care or that ongoing relationship with the patient. I suppose there was, within me, I always felt that there was something missing about the care that we could provide in hospital settings, where, you know, it wasn't longitudinal. So I found myself in 2019 working in Hamilton. So the bottom right picture is very sort of, I don't usually wear ties at all, so this is a posed photo of me in front of Hamilton Medical Group. And as you can see in this map of our training regions, Hamilton is up here in the southwest region, just a little bit south of Casterton and north of Portland, where Dr Margaret practices. So I started off at Hamilton Medical Group in 2019, which is a pretty large rural practice, which is right next door to Hamilton-based hospitals. So we provide a full gamut of general practice services, but we also are involved in providing care for people in the hospital as well. And often we have, we're on call for paediatric patients, as well as having the ability to admit our own patients for care under our big card too. So that's been a lot of fun. And in 2020, I was fortunate enough to be able to get a position with Windamara Aboriginal Corporation, which is an Aboriginal medical service that has 2 locations, one in Hamilton, another one in Haywood, which is a bit closer to Portland, probably about 15 minutes drive from Portland, would you say, Marg? So this year, and well, last year too, I've been dividing my time between working in the Aboriginal Health Service as well as Hamilton Medical Group, and I've also picked up a position with MCCC as a Registrar Medical Educator, which has been a really, really interesting experience because when I first started GP training, well, I'm here to learn. How am I supposed to, how do I, I don't really see myself being in a position to actually teach people, because what do I know? I'm just a registrar. But it's a real privilege to be able to be involved in the medical education program and to be able to it's not just teaching, but also providing peer support to my fellow registrars as well, who come through the program. A few words, and I'm not being paid by MCCC or anything to say good things, but these are genuine comments. I think one of the things that struck me with MCCC from day one was that it's a very, very well organised team. Sometimes you work with organisations and emails never get answered, people don't get back to you about queries, and there's just general slop. There's none of that. By a very well organised team of people in the various offices, beginning with people like Dr Margaret and Catherine Lawler and their wonderful colleagues. I think there's a sense that the supervisors and across the region are very much personally have a very personal vested interest in making sure that we succeed, because we're about growing the next generation of general practitioners to work not just in our region but anywhere in Australia. And I think it's your success as future registrars is our success as well, because without the next generation, our healthcare system will collapse. And I think that to seeing people consider training with us and consider entering the GP training program is really our contribution, and seeing people enter the program is our contribution, and supporting them is our contribution to sort of supporting our healthcare system. The educational program is really well structured. As you know, we haven't been able to do too many face-to-face educational opportunities this year, but we've all become professionals at working through Zoom, and I think we're really looking forward to face-to-face again, where we can actually have free food and pizzas and actually see people in flesh and blood. But I think, like I said to you before, even as a registrar, there are opportunities to be involved directly in educating and supporting your colleagues. And so I think there's a lot of flexibility and a lot of diversity in what you can do as a GP trainee. And of course, the sort of bread and butter and the backbone is actually sitting in your GP clinic, seeing patients, looking after them. But you can do research, you can do Aboriginal health, you can do education, medical education like I'm doing. There's so many different ways that you can actually structure your training, and the flexibility that you would never really be able to do in a hospital setting. And I think that's one of the real beauties of being able to train in general practice, is you can make what you want of it, and I think that's the richness of the training opportunities is a real highlight. Lots of things I've enjoyed. the continuity of care, I think, like I alluded to before, is probably the biggest privilege. It's interesting because I was kind of sitting back in my first few weeks thinking, well, do people really want to actually see me again? Or am I just going to see them and go, oh, I don't want to see that dude again? But I was pleasantly surprised that people actually wanted to see me again and kept coming to see me again. So, and so getting used to the fact that I was able to build ongoing trust and actually seeing people get better. That's enormously satisfying. But GPs provide care from the cradle to the grave, and being able to see 2-day-old neonates to looking after people in their final days of their, or even final hours of their life, an enormous privilege and a humbling experience. And I think that those are, I can think of numerous sort of people. I don't have the time to go through them today, but I can think of numerous people that I can think of that I've had the privilege of looking after, and their experiences, the experiences of looking after them, will really really highlight of really reaffirmed, I should say, my decision to do GP training. And flexibility, like I said, it's not just sitting in your GP consulting room. You can do all sorts of things to contribute to your training program through your GPT years. There's been challenges. Sometimes we feel that we're sort of pulled left, right, and centre, time constraints, pressures from having to work and study and RACGP exams, COVID. We won't go through that at the moment, but and I think let's be honest. Sometimes we can be a very isolating experience, and I think as Marg alluded to at the start of her introduction tonight, we really want registrars to be safe and supported, and not just that, but really enjoy the experience. So that's what we're here about, and we don't want you to just think of this as a tick the box exercise to fulfill the requirements for GP training. We really want you to come away enjoying the experience, and we'll work our best to do that. Hopefully I'll finish my exams this year and discover where I'll be going in 2022 and beyond. And I think the possibilities, I mean, this might sound like a bit of a cliche, but they are endless. You see GPs working in all manner of different roles. Our Deputy Chief Medical Officer is a GP. Former heads of AMA or presidents of AMA being GPs. You find them in all walks of life, and I think it just reminds us that our diverse and broad range of skills, I think, help us to adapt to all sorts of different things. So please dream big. Be involved in your community wherever you train. Keep an open mind about where you might end up, because look at me. I was a city boy, and I never thought I'd actually live in somewhere like Hamilton, but here I am, and I'm really, really enjoying it. Have life outside of medicine. Hug your dog, your cat, your pets. I play a bit of music, and this is I play in a few orchestras. Not at the moment because of COVID, but please have a life outside of medicine that you can enjoy. Look after yourself. Get yourself a GP. Find some really, really good mentors with whom your values align, and look after yourself. I hope that's been of some use, and I really welcome any questions. If you'd like to email me, that's my email address down the bottom, and I look forward to welcome you all on board. Thank you.
Thank you, Yota. And I just want to welcome Zaid, who has just joined us. Zaid is a third-year medical student at Deakin Warrnambool, and he loves it in the Southwest. And
Right.
and he's wondering what pathway options he has and when in my medical career to apply. We can answer all of those questions, Zaid. We're also recording tonight, so you can catch up on anything that you might have missed already to date. But also we're recording for people who are on the cusp of making the decision about applying for AGPT intake 2 by the 30th of September. But this will be equally as valid, and it's perfect timing, because not only can you go back and listen to Yota Yoshimitsu when I send you out the recording, who's a doctor registrar at Hamilton General Clinic.
Hamilton Medical Group.
Thank you. Thanks. I knew I had it wrong, but thank
That's
you.
right.
But you're about to hear from Dr Margaret, who also gave us a wonderful introduction at the start of the webinar, and we'll be able to talk a lot about the pathways along with Leanne Dix, who is with the Victorian Rural Generalist program. So we are running a little over time, but we started a little late. So I'm welcoming Garde, Dr Margaret, who has a variety of positions. And if you'd just like to briefly introduce yourself again, Marg, to Zaid, and then we'll call on Catherine and Leanne. So, so please, Margaret, take it away.
Thanks, Anna, and welcome, Zaid. And I'll just briefly introduce myself. So I'm a GP and I work in Portland. I've been here since the end of 1985, I think. And I've worked in various positions in Portland since I came here. But in 2002, I started to work in medical education, and I currently hold the role of Regional Head of Education for MCCC in the Southwest. And MCCC is the GP training organisation that's currently responsible for training GP registrars from Geelong across to Portland and up as far north as Casterton, Coleraine, and including Hamilton, where Yota works. So if you want to become a GP, you need to apply to Australian General Practice Training, although I think by the time you are an intern, which is when you will be able to apply, it might be that you need to choose which college you want to train with, because by then GP training will be the responsibility of the Royal Australian College of GPs or the Australian College of Rural and Remote Medicine. And so the first process, part of the process, is to apply to join the GP training program, and then you'll then get the opportunity to choose where you want to train, and you'll need to apply to train in whatever area that is. And so for us, the applications that we've received this year are for MCCC in one of its 4 locations. MCCC trains in the western part of Melbourne, and the rest of the western region of Victoria is divided into the northeast, the northwest, and the southwest, where we are. Once you start your journey, you will have various criteria that you need to complete in terms of your work before you come into general practice, and it depends on which of the colleges you choose to train with. But once you start in general practice, as Anna mentioned earlier, and I wasn't sure if you saw her presentation, but you will enter into an apprenticeship model where you work as a GP in general practice, but you will work in a practice that's accredited to be a GP training practice, and you will be supervised by experienced GP supervisors who almost inevitably have graduated from a GP training program themselves. And it's the responsibility of your training organisation to make sure that the practice meets accreditation standards and that the supervisors do too. So those supervisors are required to participate in continuing education related to the delivery of education to registrars. And so you know that wherever you work, you're going to be well supported in both the practice and by your supervisors. The other aspect of your training that you need to, or that's important to understand, is that you will also be involved in continuous education that starts from day one, where basically you have an orientation program, process that goes for a few weeks, but then every 2 weeks or periodically, you will be involved in what we call out of practice education, and Yota is involved in that. So he is one of the medical educators who delivers our education program, but you'll also have a team of medical educators who teach you in the topics and the disciplines that you need to really get your head around in order to be a good GP. Most of that's been by webinar since COVID, but hopefully going into the future, we'll have face-to-face workshops where you'll be able to learn skills as well as the theory of general practice. It's not all passive learning. You have to do things like role plays and do some presentations yourself, which I find is the best way to learn how to learn things, because if you have to learn them to teach them to someone else, then you really do need to learn it. And that goes for 12 months, doesn't it, Yota? And then in the second year that you spend in GP, you'll be a little bit less dependent on those education sessions and a little bit more independent. I need to also mention that in your first year, if you train with MCCC, you have to complete quite a comprehensive set of online learning modules. So by the time you finish your first 12 months in general practice, you've really covered the nuts and bolts, haven't you, Yota, of what you need to know. And in the second 12 months, it's more a matter of consolidating it and probably doing a little bit of work to preparing for your assessments, which take place once you have completed 12 months in GP. Yeah.
Marg, can you tell a little bit about opportunities in the Southwest as well? You know, what are the kinds of pathways that people are exploring in the Southwest, the rural pathways? What are the kinds of things that you're seeing people doing?
So rural generalism is a sort of a cut above your basic GP, and as a result, if you choose the rural generalist pathway, then you can dedicate yourself to being a GP, but having a special interest in a discipline that is perhaps necessary for your community. So you may choose to work. Just before I joined this webinar, I was chatting with a GP registrar who's done 12 months in emergency and is looking to work part-time in emergency now and part-time in general practice. There may be, I think Yota mentioned, some other various areas such as Aboriginal health or looking at an academic position. The procedural, the traditional procedural GP pathways may be down, as I mentioned, emergency, obstetrics and gynecology, or anaesthetics. The others that I think are really interesting for rural GPs are adult internal medicine, so that you have special skills and knowledge in support in looking after patients in hospital who may have pneumonia or cardiac issues or pretty medical problems, but you won't be an interventional cardiologist if you do adult internal medicine as a GP, but you will be able to look after a vast array of medical presentations that that we see in general practice and look after them, look after your patients in hospital. You can, even if you are ambitious enough, you can do an advanced skills post in surgery. And if you see yourself as maybe wanting to do scopes and take out appendixes and do some basic other surgical procedures, that's a 2-year advanced skills position. But that's also that as Yota mentioned earlier, you can dream big, and if there's anything that really takes your fancy, then there's probably a way to go about it. Some of the other disciplines we can offer in terms of advanced skills are things like palliative care and pediatrics. But as I said, you know, there's a lot that's out there that you can explore.
And Leanne is also going to cover off on some of those as well. So can you tell a little bit about the range of practices that we have in the Southwest? Because there's a huge diversity of practices. And Yota also managed the Aboriginal Health Service that he worked in. So just in terms of the huge diversity that people have to choose from.
I think Yota works in one of the largest practices in the Southwest, actually. And just a few kilometres up the road is one of our smallest ones, which is Casterton Coleraine. And so we've got a huge array of practices across the Southwest. I think the opportunity to work in Aboriginal health is a really exciting one for registrars. I've worked in Aboriginal health for 7 years, and Yota's now coming up, is it 18 months, just over 18 months that you've been working in Aboriginal health?
Yes, I think so. I started February last year, I think, something like that.
So we don't,
time flies.
Yeah, so we like registrars to develop a basic groundwork in their GP skills and knowledge before they move into a subspecialty kind of practice like Aboriginal health. But once you get your head around general practice, there's the opportunity to work in Aboriginal health in Portland, in Warrnambool, and in Hamilton and in Haywood. So, and those practices are great. They're all really lovely practices to work in. Sometimes you may not always have a supervisor on site, but we arrange for supervision to be provided to you in such a way that you've always got somebody to ask at any time about anything if you need it. There are also some extended skills posts that are available. They're sort of subspecialty posts for registrars who only want to work for 6 months in those posts. And have I missed anything else, Leanne or Catherine or Yota? I can't think of any others that we've got.
Yeah, I think there's also is 1 year of intern sufficient to apply for the program? Catherine, do you want to take that one?
Sure. So you can definitely apply as an intern. We do have registrars that do that. But what that means, if you were to apply in your intern year, you would then complete your PGY 2 year in hospital within the MCCC program. And from there, completing a year in hospital as part of our program, you don't need to apply for recognition of prior learning, which does take some, work out of things. We have some registrars that do need RPL, but if you were to complete it with MCCC, you skip that step.
Thanks, Catherine. That's terrific. Marg, do you want to just briefly outline your 5 top tips or 3 top tips for making a life and a living as a GP in Southwest Victoria?
Yes, top tips. I think number one, you need to dedicate yourself to to embracing everything that general practice has to offer, and also dedicate yourself to embracing the learning opportunities that being in a training program presents to you. There's really a huge menu to choose from. We give you every opportunity to learn as much as everything that you need to learn to be a GP. And that doesn't necessarily mean in terms of the theoretical stuff. It's about learning the art of general practice, and you'll learn that from your supervisors. And you'll also probably learn it a little bit from your peers. So that's one tip. The next tip would be get into wherever you are, get into the actual environment and the beauty of the place that you're living in. So I live on the coast. I've got national parks just 5 minutes away. There's not a weekend goes by where I don't go out and explore my environment and just get connected with where I live. And number 3, I think, would be to also connect with your peers, because I hear every single time I speak to registrars, I do almost every end of training interview, and every single time I spent talking to registrars who are about to finish their training, they say, I value so much the time I spend with my peers, how much I learn from their experiences, how much I learn from just talking to them about their practices, their patients, the way they do things. It is really important, and you need your peers when you're studying for your assessments as well. They're a valuable resource. We provide you with all of those things, but I think don't underestimate the power of your peers and how much they can mean to you in your training.
I completely second that, Marg. Sorry to interrupt.
No, that's fantastic. Thank you very much. We might move on to Catherine, and Catherine's just going to run through the 2 pathways, the RSEGP. I think Leanne will cover off on the rural generalist pathway, but I'll just start that from the beginning. Just bear with me. I'll just share my screen. And there. Okay. Catherine, take it away. And if you just quickly introduce who you are, just so Zaid knows, but again, visualise Zaid surrounded by a range of other people applying for AGPT intake 2 as well.
So I'm Catherine, the REAPS coordinator covering the Southwest region. So essentially my role stands for Registrar Education and Practice Support. So largely what I do is work closely with our registrars in tailoring what they would like their training to look like. And most of them are very different. We have, a number of different pathways and training options that registrars can do. So it's my role in making them happen, if I can. But that's essentially, a big part of what my role is. So the slide that we have and that I'll run through just gives you a really good visual and something easy that gives you an idea of what the 2 colleges look like. So ACRM you've got in the centre. So essentially you've got your hospital time, which is 12 months. And then you've got your core generalist training, which is CGT. And that's 24 months, so 2 years that you spend in GP. You then got 12 months that you can complete in advanced skills. And as part of ACRM, you can actually get an additional 12 months to do any additional skills that you would like to do, whether that's a second advanced year, perhaps you would like to do 2 6 months of different disciplines. As I said, there's so many ways that you can tailor your training with both colleges. Both of them have different options, which is where I come in to help you with that. So basically any of those can be mixed around. You can do them in basically every different order if you would like to, basically to tailor again, you know, and also what's happening in your personal life. If you have a family, all that, you know, changes at certain times. And that's what we're here for, is to make the program work for you. So RACGP is similar. So you have your 12 months of hospital. And as I mentioned before, you can do that within the training program, or you can, you know, apply for RPL for experience that you've completed prior to joining MCCC. So either way, you have your 12 months. You then have 12 months in GP of GPT 1 and 2. And then the second half, you have 6 months in GPT 3. And then registrars have an opportunity to do 6 months either in a particular discipline, for example, perhaps emergency or pediatrics, or you can do those extended skills in GP and have 2 years in general practice instead. We have a number of registrars that do that. And then depending on what pathway you are in, if you're on our rural generalist pathway, you've got that 12 months of advanced skills. And if you are a FAR GP registrar, another pathway that you have available, you also get the additional 12 months when you fellow with RACGP to finish off those modules associated with FAR GP. So obviously it's all optional and it's all there, basically what you would like to do.
Thanks, Catherine. Just advance. Did you want to just touch on any of these?
Yeah, absolutely. I can go through and talk in particular the support that you have from when you join MCCC. So as I mentioned before, I'm the RICS coordinator for the region. So I work closely with you and also with Marg, who's with us tonight. We work closely to tailor your training and make sure you're meeting your obligations of the college. Under that, we also have MCCC operational staff that are also available to you. We have training support officer who, you know, case manages your portfolio, makes sure it's being recorded correctly. And also, you know, making sure that you're again meeting your training requirements. So we're there working alongside of you. So it's not just yourself. You know, it can be quite confusing as you move through, and that's what we're here for with our staff. With MCCC, you have every single registrar has their own training advisor, which is that, you know, someone external, you know, outside of MCCC, but one of our medical educators. So each registrar gets one of those if you're having maybe any issues with the practice or anything like that. They're on hand to talk to you and meet with you regularly, make sure that you're progressing, that you're comfortable, you feel safe, that side of things. So we have all of those, and also in your cohort that you go to workshops with. So you get to mingle and get to know everyone and work nice and closely.
Do you want to talk about the AGPT2, the fact that we're offering only a rural pathway or rural generalist pathway here, Catherine? Yeah,
so part of the intake 2, the Southwest in particular has some certain places available pending our capacity to take on additional registrars, and whether we're able to fill our practices that have vacancies. So, for example, those are in rural practices. For example, Hamilton, Coleraine, Casterton, and I think Camperdown and Terang as well, if we're not able to fill those. Otherwise, all other registrars that are successful in intake 2 will still come into the program, but otherwise will just remain in hospital for the following year. As I mentioned before, no need for RPL, so it's still a great opportunity and something you don't want to miss out on. But that is essentially what it is. We also have vacancies in our northeast region. So that's up in Albury and Wodonga, Wangaratta way. And they also have their own priority practices that if they're not able to fill them and you're able to join MCCC, that you can join those vacancies or otherwise remain in hospital for a year.
Thanks, Catherine. That's terrific. I might get you to come back in, but what I thought that I'd do is just basically stop sharing for a moment and get Leanne to talk about rural generalism, and then we'll come back to hospital experience assessments and RPLs towards the end of our presentation, and then we'll finish up hopefully in about another 5 to 10 minutes. So just bear with me. Leanne, just tell me when you need a slide advanced.
Yeah, I'll just flick through the slides and speak to them sort of in a summary.
Yes.
Yeah,
Yep.
so
Just tell me
yep.
when you want, to advance, basically.
Okay. So my name's Leanne Dix. I'm the Barwon Southwest Region Rural Generalist Coordinator. So you can, yep. So probably one question is, what is a rural generalist? So this is quite a wordy, detailed description. So, but basically a rural generalist is a fellow of either ACRM or a fellow of RACGP with their additional rural generalist qualification, currently the FAR-GP. But we might go to the next slide because I think that probably...
That's much easier to understand,
yes,
isn't it? Yep.
Because rural generalists, it's not a new concept. I'm sure many of you, Marg, and Yota have met some amazing rural GPs that meet this definition. So, however, the term RG has been introduced to distinguish this subspecialty group of doctors from other regional or rural GPs that may not have the additional skill set required for rural generalism, and just to provide a definite training pathway for the junior doctors who wish to become an RG. So a rural generalist is a rural medical practitioner that is trained to meet the specific needs of rural and remote communities and provides GP and emergency care with the advanced skill.
Sorry.
No, you're right, keep going. So what is VRGP? So basically, VRGP was established at a national level. So the VRGP is a Victorian approach to the national strategy to increase improved training and employment. Just to be clear, the VRGP is not a training provider, but a coordination unit that provides support for RG trainees, training providers and employees of RGs. So we provide support at a regional level and right from RG1 through to fellowship. Over there. So in terms of the support, we have 5 regional coordinators across the 5 regions of Victoria. We have clinical leads in anaesthetics, obstetrics, emergency medicine and paediatrics. So we hook the trainees up with the clinical leads if need be, and we work closely with the clinical leads in all the 5 regions, and the 5 coordinators work closely together too, because we have trainees that move across the regions, so we can case manage and support them with future trainings and employment needs. And we work closely with training providers, health services to support the development of training opportunities in the region. And we're sort of governed by, which is probably a bit administrative and maybe not much interest, but it's a regional network that endorses the needs and workforce needs across the region.
Leanne, do you want to just mention how closely MCCC, GP training and VRGP works together to make posts happen?
Yeah, so we do work closely with MCCC, both in terms of case management of the trainee, so with employment opportunities, but like you said, with accreditation, when an opportunity comes up, well, at the moment where I'm actually working with MCCC and they're accrediting a health service to enable a trainee to do their consolidation of skills in 2022 there. So yeah, we have a very close working relationship, which actually is beneficial both to the trainee and the region. Right,
so tell us about the benefits.
Okay, so the benefits are to provide case management support, help you choose the right RG training pathway, and just assist in navigating your way through the training requirements. And I think, yeah, and as we've moved along, the clinical leads also help with that career support and training advice. So it's sort of a real collaborative team approach to support the trainee, in particular from the intern right through. I think there's maybe a little bit of a gap in that earlier pre-vocational years where they might be sort of looking to where they go. So we sort of start off right at the start and go through and hook them up with the right people.
Would you like me to go on to your model?
Yep, that's fine.
Just here, and that'll help to, yeah, just to give that what that actually end to end looks like. Yeah,
that's right. I won't go into a great detail here. I'll probably go to the next. I'll just
next one.
Yeah, I think so, to see what's in the actual region, which is that's basically been covered up in Catherine's and Marg's talk, so we won't repeat there. They'll have it. I just will point out, I suppose, for
especially for Zaid, I think it's really great for him to know about the RG1 and 2 positions.
So Zaid, currently there's 5 RG1 positions, and they're located at Southwest Healthcare with their core rotations as listed on the slide. And then there's 5 RG2 positions also located at Southwest Healthcare, and you can see
they're both intern positions, aren't they, Leanne?
5 interns, and then 5, which was called PGY2, RG2, second year, hospital. Yeah.
Next one.
Yep.
Great.
So this is the advanced skills positions that are available for this year, 2021. And I've highlighted in yellow. I don't know whether it's not on your screen, is it? No, that's okay. So currently we have filled our anaesthetics and emergency medicine with vacancies in obstetrics at Southwest Healthcare, obstetrics at Barwon Health Service, and paediatrics both at Southwest Healthcare and Barwon Health Services. And we have a new post, a blended post, 6 months paediatrics Portland and 6 months Barwon Health, which is also vacant. So we're currently case managing trainees now to see if we can fill those positions.
And there are opportunities for applicants who are successful into the AGPT intake 2, if they can get their health experience assessment in. There are still some opportunities until I think November, aren't there, to fill these places for anyone who is listening to the recording.
Yeah, that's correct. Yep. And they can just contact me. I've got a slide at the end, or reach out and we can discuss their pathway. So the next one is again about the RGA. As I said, we've got the 4 disciplines at the moment, and we're working on a palliative care for 2023 for the region. So that's probably in progress now, but that's a list across the state. For Barwon Southwest, we don't have adult internal medicine or mental health either at this stage, so there'll be another work in progress. But I think that's probably please just ask if you want me to
I'm going to ask you a couple. I'm going to ask you a couple of questions at the end, Leanne, and I'm also going to see if Saeed would like to have any questions answered as well.
Yeah, that sounds good.
Sorry.
And this is the consolidation of skills. So as it says in the slide, it's a program enables rural medical practitioners to complete some procedural advanced skills trainings. And that's probably where we do work really closely with MCCC, because it's a collaborative affair, well and truly, as Catherine and Marg will agree, I would think. So that's an integral part where we both work very closely together with the health services. I think that's fairly straightforward. Are you happy for if you're viewing this to read through? And please, if there's anything you wish to ask me, I've got my that's a testimonial from one of our RGs from this year. It's been supported by both ourselves and MCCC. And then, yeah, if you've got any questions, I think the best way is to either come and see me or perhaps with COVID, give me a call or email me first, and I'll let you know where I am or where I'm allowed in to see you. Or Zoom it'll have to be.
So Leanne, there are wonderful opportunities, not only for people coming into the intake 2 for AGP2, but also for medical students to join up once they get into their intern year, is to actually go onto the VRGP website and express interest in, and from that stage, and Zaid's saying he doesn't have any questions at the moment, but what I was really keen to for you to go into detail, because it is quite different, is that it can move. VRGP, Rural Generalism in Victoria, travels with you from the discussions that you can have at pre-vocational stage, like where Zaid is at the moment, but then also into creating a pathway where you've got certainty as you move through the first year of your first intern year as a rural generalist, into your second intern year as a rural generalist, and then to advance into time in practice, and then advanced skills and rural consolidation. So instead of having to go hunting for opportunities every year, if you're interested in the rural generalist pathway, you really have this support from, sort of almost from now. You can start having the conversations, but then you have opportunities that are arising from the first, year 1 intern, year 2, and into registrar education as well, wouldn't you say?
Yeah, that is correct. Like probably just before the intern match took place, I think there was probably about 12 or could have even been 15 students came up and had a chat from Deakin, and we could have a bit of a talk and take, because it is very overwhelming. I can imagine all the choice and different things. So we've had a good relationship there with Deakin, the supervisor for the internship there. So yeah, the discussions definitely start well before the internship, and then we can have a bit more of a clearer view what's ahead and what's available too, I think.
So as we close out, I just want to encourage you, Zaid, and anyone else who's listening to the recording, to make contact with Leanne using the contact details below. And also, if you don't remember that, just Google VRGP, look at express interest, put your name into the form, and you'll have definitely people following you up. Leanne or one of her other fellow coordinators will help you with that. Marg, you'd love to ask a question or make a comment?
I wanted to make a comment, if that's okay, Anna. Just two things. First of all, I've got I have the feeling that this must, for anybody who's listening and watching, that we have just given them an overwhelming tsunami of information that is really hard to digest. We live and breathe this stuff. And for those people who are on the threshold of making a choice, this might all seem like it's incredibly overwhelming. So final message from me, number one, is talk to GP registrars who may be working in hospital already, or people who are, you know, working in hospital and thinking about doing GP like you will be in a few years' time. And in my practice, we've got RCCS deacon students, and we've got registrars, and we've got interns from the hospital, and we've got everybody else. And so they talk to one another, and they share they share information, and that, you know, that's the best way to find stuff out. But the other thing is that there are a few websites that are probably really critical for you to just explore. And one is the RACGP website, the other one's the ACRM website, and the other one would be the VRGP website. Leanne, have you got any others that you think are good?
No, I think that would be well and truly enough.
Yeah, that's three's
Yeah.
enough. Yeah.
Yeah.
So, and then just talk to people who are training for their FACRM, talk to people who are training with their RACGP. But, you know, obviously the people you're probably going to come in contact with the closest are going to be those who you work with in hospital. But you might even want to ask your own GP. You know, they've probably done GP training if they're, as long as you feel you can relate to them. Yota, do you have any?
Oh, look, I don't really have too much else to add. Actually, that reminds me, one of my early inspirations to do GP was actually my own GP in Geelong. So if Joe DiStefano's listening, thank you, Joe, because I think I can't emphasize how important good role models are, and how much of a positive influence that can be in your journey. So seek those people out and ask them.
So in the last couple of minutes, I'm just going to get Catherine to run through, for people who will watch the recording, the hospital experience assessment and the need to get that in early for intake 2, and just RPL, and then we'll close off on the call. Just bear with me. So Catherine, would you like to just finish off just by talking about the importance, without going into too much detail, the importance of the hospital experience assessment in the application process for intake 2?
Yeah, so basically your hospital experience assessment is what you complete when you apply to MCCC. So Marg and I actually go through these individually and look at your hospital experience. And from there, this is how we deem yourselves practice ready, or whether you perhaps need that additional year in hospital as part of our program and then skip the RPL step. So what we look for in ACRM, you have your core mandatory rotations. So you've got Gen Med, Gen Surg, and Emergency. And then you've also got some other disciplines that you also need to consider, which is PEDS, O&G, and anaesthetics. So not all the last 3 disciplines that I mentioned need to be completed prior to you actually starting with MCCC. There are a number of ways you can actually meet them throughout your training. For example, via courses or things like that. So it's just important to note that you only need those 3 mandatory ones. So Gen Med, Gen Surg, and Emergency. RACGP also have their own mandatory core rotations. So Gen Med, Gen Surg, Emergency, and PEDS as well. And then along with those 3, you also have 3 disciplines showing your breadth of experience. So that can be things like mental health, palliative care, aged care, rehab, RAPU, you know, all those types of things. There are a number of specialties that you can have included as part of your HEA. And we go through those. And if you need any further experience or we have questions, we get in contact with you and work through them with you.
Right.
So your RPL is a different process, but as I said, we do assess these at the exact same time. So we're able to tell you whether you'll need RPL. So RPL reduces your training time. So as I've mentioned a couple of times, if you're not completing your hospital time within the program, you complete your RPL, which counts as experience you have completed prior to joining with MCCC, and you can commence straight into general practice if you're deemed practice ready as part of our HEA process. So each college has different requirements, rotations and that side of things, but someone here that might be watching the recording, a big thing to note is keeping your end of term assessments or HMO reports. They come in handy. They're useful for RPL and also your statements of service. So all of those things are included in as part of an RPL application. And again, we work through with you, we guide you through the whole process. Other than yourselves actually writing out the application and the pro formas, where they're guiding you how much and what rotations would be the best and the easiest way to get you through the process.
And Catherine, just for people listening to the recording who are applying, could you just mention the deadline for HEAs to allow people to have opportunities to get into general practice and or hospital advanced skills post if they're practice ready? I think it's the 15th of October. They need to get their HEAs in by.
We definitely recommend that you get them in as soon as you can, because the earlier is the better. Marg and I, as I said, we go through these individually. We have quite a number of them to get through. So the earlier the better with all of the documentation. So if you have that prepared and know what you need, it's really easy just to send that through on our portal.
Thank you very much. I really appreciate that. Actually, I've forgotten my own contacts. So please email us at info@mccc.com.au. There's an individual training advice phone on our hotline, as is evidenced on this slide. And please join our social networks. They're really active on Facebook, Instagram now, and LinkedIn. Yota, did you want to say something?
No, that's all very good information. Yeah.
Excellent. Thank you very much. We have gone very far over time, but it has been certainly probably the most comprehensive webinar. We wanted to give you the opportunity, Zaid. It's probably been a wonderful opportunity to really look at the pathways towards AGPT intake 2, and we hope that you found it useful. We hope anyone listening to the recording finds it useful. Please get in touch with us. We're here to help you, and we're delighted at your interest, and we hope you make the decision about applying to AGPT 2 intake 2, and we look forward to supporting you on your journey. Thank you, one and all. Thanks, Marg, Leanne, Yota, and Catherine. Thank you, Zaid, for attending, and we really look forward to answering any more of your questions. Thank you. Bye.
Thank you. Bye.
Thanks, one and all. Have a good evening.
Bye.